Good evening, dear viewers, and welcome to a new episode of Medical Talk, the program that brings you trusted medical knowledge and expert insights to help you and your family live healthier, stronger lives. Today, we explore a condition often called the silent bone thief, osteoporosis, a disease that weakens the bones gradually and quietly without symptoms until a simple fall or even a mild movement can lead to a serious fracture. As life expectancy increases, osteoporosis has become a growing global concern, affecting both men and women, but with a noticeably higher prevalence among women. Understanding bone health is essential at every age because the choices we make in our youth and adulthood determine the strength of our bones later in life. From calcium and vitamin D to exercise, hormones, and modern treatments, every factor plays a role in protecting on our skeletal foundation. We are honored tonight to welcome Dr. Mohammad Alfeeli, a specialist orthopedic and spinal surgeon, who will guide us through the causes and prevention and most effective treatments available today for osteoporosis. Stay with us. We are watching Medical Talk. Welcome back. We're happy to have with us in the studio Dr. Mohammad Alfeeli, a specialist orthopedic and spinal surgeon. Dr. Mohammad, welcome to Medical Talk.
Thank you. Thanks for having me today. It's my pleasure to be with you today to orientate the public about the importance of caring for our spine.
Exactly, and I'm so honored to have you with me because I have so many questions. Today's topic is very, I would say, controversial. A lot of people have maybe some misconceptions about it. That's why we want to shed the light on some of the basic fundamentals. Let's start with what exactly is osteoporosis and how does it cause bones to become weak and fragile?
So in order to understand osteoporosis, we have to understand the basic anatomy of bones so that when we explain osteoporosis, it would be clearer to the audience that we're speaking about. As you can see in the picture, on the right-hand side, you can see healthy bone, where the outer cortex in the white, thick white line, and then an inner cortex that is, an inner medulla that is filled with woven bone. On the left-hand side, if we can see in the picture, we see almost an empty medulla. Because that happens because as we age and other factors contribute to that, such as hormonal support, level of activity, vitamin D, and calcium intake, all contribute to the resorption of the woven bone, which makes the bone healthy and strong on the outer side, which is the cortical bone. However, as we go inside the bone, into the woven bone, it would become a fragile and almost empty bone. The bone would be like a biscuit, very hard on the outside and nothing else, very thin and fragile on the inside. And this is what causes osteoporosis.
Exactly. So it's more of a structural condition that affects the bone and comes with many issues.
Yeah.
So what are the main risk factors behind osteoporosis and how do lifestyle, age, genetics contribute to developing this condition?
If we take each of these factors individually, we can have large talk on each of them. But to sum it, to say it in short sentences, all of these are contributing factors, starting with genetics. Genetic predisposition is a key factor in determining if you're getting osteoporosis or not and at what age. Another factor, which is very, very important, is the lifestyle. As long as you keep fit and moving around, loading your muscles and bones with weight and exercise, you're very unlikely to develop osteoporosis. On the other hand, if you live a sedentary lifestyle, then you're very likely to develop osteoporosis earlier in life. If we go into the female side, as long as they have the estrogen support in their early years, they are very unlikely to develop osteoporosis. However, we've seen even women at younger ages developing osteoporosis. It's not very common though. Once the estrogen support is being withheld as the woman reach menopause, then they'll be losing their bone density, and in the men it will be testosterone. So above the age of 65, 70, where they'll be losing more of their testosterone support, then there will be a timeline where we'll see osteoporosis even in men. Nevertheless, a good balanced diet plays a key role there, because if we have enough protein, enough calcium intake, then that supports our bone health and makes it very unlikely to develop osteoporosis. To the contrary, where we have a poor diet, such as anorexia nervosa and other metabolic syndromes, which makes you more likely to develop osteoporosis. Moreover, some diseases do contribute, like hyperparathyroidism, because of the excess of parathyroid hormone that makes resorption of the bone. Cancer as well would play a major role there in developing osteoporosis and osteoporotic fractures.
So it's basically, it's a multifactorial disease. It could happen to many reasons. And I'm glad that you mentioned, you touched on the male and female comparison, because many of our viewers wonder, if is it true that women are more likely to develop osteoporosis than men? And if so, why are women more vulnerable biologically? And you know, you've touched on the hormones as well.
Yeah, so we touched on that, and to get a bit more a deeper dive there, we can say, yeah, women do develop osteoporosis more profoundly than men do, because usually women, as they age, they tend to go to a more sedentary lifestyle than men. With the hormonal support withdrawal, i.e. estrogen withdrawal, they'll be more susceptible to the osteoporosis, because as they lose the hormonal support, the bone resorption would happen at a higher rate. In addition to their sedentary lifestyle, lack of exercise, lack of resistance exercise. To the contrary, if we see, if we go to a society where women are the main workforce, you will not see as evident osteoporosis as you see in developed societies, where women can have some sedentary lifestyle more than others.
Exactly, and be more active, basically.
Yes.
Yeah, and more I would say dependent or independent. I would say they would actually walk and do their all task every day on their home.
It's not only the task they do. For example, if you go to a society where women are working as farmers, or they'll be doing loading,
hard labor, basically.
Hard labor.
Yeah.
They will be less susceptible to develop osteoporosis because of the load they are exposing their bones to. Their bones cannot lose calcium, even if they lose the hormonal support, because they'll have the muscle load that will keep the calcium on the bone.
That's very interesting, and I have so many questions, but we have to take a short break. There is a report. We're going to watch it together, and we'll be right back. Stay with us. Welcome back. We're still talking in the studio to Dr. Mohammad Alfeeli. Dr. Mohammad, before the break, we were talking about the basics and the fundamentals of osteoporosis. Now, I want to ask you, why is it often called the silent disease, and why does it progress without symptoms? And what early signs, if any, should people pay attention to?
So that's an interesting question. A silent disease is defined by its name, silent, because it usually doesn't have any symptoms or signs. And the early sign you'll find is when you broke a bone. Then you do investigate, why do I break a bone? With a trivial trauma or no trauma at all?
Yeah.
And you'll diagnose the osteoporosis. Or it will be an incidental finding while you're doing your checkup.
Yeah.
Without any symptoms or any signs at all.
Yeah.
However, seldom, you can develop some bony aches that come and go, but that does not specifically diagnose osteoporosis. Osteoporosis is usually diagnosed by specialized type of X-rays to measure the bone mineral density, and by that only we can stratify how good how healthy the bones are.
I understand that. So how do we diagnose osteoporosis today?
So osteoporosis is diagnosed using a specialized type of X-ray called DEXA X-ray, or with a special type of CT scan, quantitative CT scan for the bone. And both of these methods depends on the calcium content of the bone, and they compare. Then there is a database that the WHO has made with an average of the bone density, and it is at different age groups, and then this set a score that is compared against these databases. And basically, if you're less than 2.5 of the median of that baseline, you're diagnosed with osteoporosis. However, we must not forget that there's an intermediary between a normal bone and an osteoporotic bone, which is what's called osteopenia. Osteopenia, where the bone is very likely to be developing osteoporosis. However, we're not at that stage yet. We're more prone to have fractures risk. At that point, it's still reversible to a healthy bone by modifying the lifestyle, adding some calcium and vitamin D supplements, and adding some exercise to our lifestyle. Usually that does the trick. Sometimes we need some extra hormonal support or other means to treat the osteoporosis.
Nice. And assuming that we have established somebody goes through the screening process and been officially diagnosed with osteoporosis, what are the basically main treatment options available today?
So, as we spoke earlier, the main key in the treatment of osteoporosis is lifestyle change. Lifestyle change include doing more exercise, being more active, and having a balanced diet with all the essential calcium and vitamins. Because even though vitamin D is mentioned as the most important, we must not ignore the role of vitamin C, which plays an important role in the synthesis of collagen, which is the basis of bone synthesis. So even vitamin C, other vitamins, minerals such as calcium, magnesium, phosphorus, all contribute to healthy bone. And if we lack these from our dietary intake, we cannot synthesize these on our body cannot make them up. So it's important to have all of these taken with the required amounts on a daily basis. A study was done here in Kuwait showed that at least 2 cups of milk or yogurt, a slice of cheese is the minimum to have your daily requirement of calcium. And with the government laws in adding vitamin D to dairy products, it should supply you with at least half of your daily needs of vitamin D. Nevertheless, we should, despite having a sunny weather, usually we're not exposed to sun enough.
Yes.
Which is the key in activating vitamin D in the body.
Yeah, absolutely. And everybody almost in Kuwait is having a vitamin D deficiency, despite the fact that we are a sunny, very hot country.
Yeah.
And as you said, because maybe it's due that the fact that we're not exposed to the sun a lot due to the heat. But interesting that all those the elements that you mentioned, these are just normal. It seems to me like these are just normal supplements. These are not real pharmaceutical medication.
Yeah. So when we go to pharmaceutical medication,
exactly.
are there treatment options? Yes, there are. But usually we reserve those treatments for those who are likely to develop fractures. Because when we do the BMD studies, we stratify our patients into higher risk of fractures versus lower risk of fractures. And those with high risk of fractures can take either tablet form of medications or an injectable form of medications. And these are usually to reverse the metabolic resorption of bone. new advancement with anabolic agents have been a breakthrough in the last decade or so, which can really synthesize the bone back, while the other treatments, which are 6-monthly injections or the weekly tablets, are usually helps to stop the loss of bony density, and is only rely on your exercise and diet again to restore your bony structure.
Exactly. So this is basically the foundation for a success treatment is lifestyle change and diet and exercise. Now, a lot of people, they fear the long-term effect of medications. Do medications, like you mentioned, is it oral tablets or injections for treating osteoporosis, have any long-term consequences or signs or side effects?
Yeah, well, there's no medication, even no food without side effects.
Yeah.
Even drinking water can have side effects. So are there side effects? Yes, there are. Are there long-term consequences? Yes, there are. However, when we see the balance between having these medications, preventing the fractures that are associated with them, did we take into account, when you ask about the side effects, did we take into account what are the side effects of osteoporotic fractures? Did we ask what are the risks of developing osteoporotic fractures? These are almost ignored questions. They are key in the treatment of osteoporotic fractures. Why? Imagine that if an elderly woman or an elderly man slips in the bathroom and fractures his hip, his mortality risk, his risk of dying within the next 6 months is increased by 30%.
That's a significant number.
And that's if it's treated surgically. If left untreated, the risk of mortality is almost 100% at 6 months. So these are significant numbers. And it's mortality we're speaking here. It's not only morbidity. When we speak about the side effects of medications, almost morbidity, some side effects regarding the gastrointestinal tract or something like that. Yes, with the anabolic agent, there's a very seldom side effect, which is very, very rare, because it's anabolic. It increases the cell production. So if you have a silent tumor, it can activate it, and that's why it's contraindicated in patients who have a history of cancer.
Exactly. And also during the break, you and I, we were talking about the fracture that could happen because of osteoporosis, and you brought with you, as you see, like a prop that can show us to our viewers how significant this could happen.
So yeah,
so it's just an example.
I brought this sample of a thoracolumbar spine.
So basically, this is the human spine.
Yeah. Okay. So this is the human spine,
and this is the lower part, I would say.
So this is the sacrum here. This is the lumbar spine, and this is the thoracic spine. And here we can see with this vertebra where it's wedged anteriorly. This is what an osteoporotic fracture looks like on X-ray. And this fracture, if left untreated, we spoke earlier about the hip fractures, the spinal fractures. If left untreated, they can increase your mortality rate 55%. in 1 year time. If you treat it surgically, we have different treatment options. I can show you here one of the treatment options, which is surgical fixation with screws and rods, along with cement injected into the fractured vertebra. This can reduce the mortality risk at least 50%.
Wow.
To less than 25%. One of the studies that studied the spinal osteoporotic fractures, pathological fracture of the spine, that were treated surgically versus those who were treated non-surgically, it found a 55% decrease in mortality 10 years later. which is a very long follow-up.
Yeah, that's exactly. That's very interesting. Dr. Mohammad Alfeeli, unfortunately, that's all the time we have today. Thank you so much.
My pleasure.
I had so many questions, but I couldn't finish them all. Thank you so much for your time.
My pleasure.
And for all the valuable information that you shared with us, and hopefully we'll be able to host you again in Medical Talk.
Sure.
Thank you so much.
Sure, thank you.
Dear viewers, we'll still have more to come. Please stay with us. Dear viewers, family health is built on small habits that we practice every day, from staying active to eating balanced meals to ensuring regular medical checkups. When families support one another, they create a healthier environment that strengthens both physical and emotional well-being. Simple actions like shared meals, daily walks, open conversation, and encouraging each family members to care for their body can make a remarkable difference in long-term health. Let's move now to our family health tips.
Hello everyone. Today I would like to talk about a topic that most parents are curious about and some parents worried about, which is the fluoride. So I'm definitely sure that you've heard several opinions regarding the fluoride. Is it safe or not? So in order to know that, I have to explain more about the fluoride. So the fluoride, from where does it come from? It is a natural mineral that can be found in water, in food such as tea or fish. So based on the studies, it proved that the fluoride is safe and effective. So don't worry, it is safe. You can use it on your kids. So what does the fluoride do? The fluoride can strengthen the enamel, the outer layer on the tooth surface, so it will be more resistant to the cavity-causing bacteria and the acid that they produce. Also, it can reduce the amount and the number of the bacteria that cause cavities. So it is one of the most important things that we use on a daily basis, or also in the clinic, for protecting the teeth from having cavities. So one of the most common questions that comes from the parent is, how much do we use the fluoride? As long as you use the fluoride with the right amount and concentration based on the child age, it will be safe. So it should be used correctly. So you can use a pea size of a toothpaste on a brush for kids who can spit, or you can use a smear layer of a toothpaste with the fluoride if the child cannot spit. This is one thing. The other thing is that you can use it every 4 to 6 months with the dentist in the clinic. Other things that you can use, like mouthwashes with fluorides, that's also used for depending on the age of the child and whether they are more prone to have cavities or not. So it's really important to know that fluoride is safe, natural, and effective in protecting teeth from having cavity. Thank you very much.
And that brings us to the end of tonight's episode of Medical Talk. Osteoporosis is a preventable and treatable, and awareness is the first step toward stronger, healthier bones. With early screening, proper nutrition, and regular exercise, we can protect our bone health and prevent serious fractures in the future. Thank you for watching Medical Talk. Until we see you again, please stay safe and stay healthy.